Nancy Pelosi calling average Americans who show up at town halls un-American. And now the Obama administration getting fuel to the fire, telling senators, quote, if you get hit, we will punch back twice as hard.
Is this proof the administration can't sell the health care bill or just having a lot of trouble? Georgia Congressman Tom Price joins us right now from our nation's capital. Or no, you're down in Atlanta, aren't you? Good morning to you, Congressman.
Down in Atlanta, that's correct.
Okay.
In Atlanta, good to see you this morning.
Okay. Hey, Congressman, let's start with what Brian just touched on. What do you make of Nancy Pelosi and Steny Hoyer yesterday writing in USA Today that drowning out opposing views simply un-American?
Well, it's disappointing and it's sad, truly. We ought to be having a debate about one of the most important things, that's health care. Before I went to Congress, I was a physician, took care of patients. Americans across this land are very concerned about this bill, and then you have the Speaker of the House saying any dissent to her opinion is un-American. It's astounding.
Yeah.
Yet Bill Burton pretty much tell Nancy Pelosi she's wrong. And he is, of course, the Deputy Communications Director of the White House, saying it's a long tradition in America to shout at politicians. But do you agree, Congressman, you should shout but also listen at these town halls?
Now, we ought to be respectful without a doubt, but the shouting is symptomatic of the way that the entire process has been closed. Republicans have been shut out of the process. The American people have been shut out of the process. And that's what they're voicing their concern about, which is why it's so important we have August to allow the American people to read the bill and recognize that this is a huge expansion of government and a takeover of our health care system.
Congressman, I think there's a lot of frustration, and you can see it in those pictures there, that the stimulus package got rammed down our throats. Nobody read it. Nobody in Congress read it.
That's right.
And now, only 10% of it has been spent, and people are going, why'd we do that? It was so costly. And I think people were just really worried that we wouldn't have a chance to talk it over. And now, because there was a delay of game in the House and the Senate, there you members of Congress are with a month on your hands, and you're getting an earful. What are your people telling you?
Which is exactly what ought to occur across this land. What I hear from my folks here in northern Atlanta is that they are very concerned about the government running health care. They don't believe that the government ought to be inserted between doctors and patients, and that's one of the primary concerns that they have. They don't believe that the government ought to be dictating what kind of health insurance that they have. They believe they ought to be able to pick it. They want to make certain they can pick their doctor and pick the place where they're treated. And none of those things are able to be accomplished through the current bill that's in the House.
Well, Congressman, what do you say to people? And first, I want to bring you to this quote from the White House, and this is from the Deputy Chief of Staff. He says, if you get hit, we will punch back twice as hard. That essentially means that if Republicans come out and protest the bill or shout you down, I want you to hit back twice as hard. Is that playing into some of the violence that we're seeing at these events?
Well, I think so. It's also this kind of Chicago mentality, political mentality, that's come to Washington now. Again, this is really very, very disappointing, because what we ought to be doing is having a debate, an honest debate, about one of the most important things for any of us across this land, and that's our health care. Instead, we see this remarkable arrogance, both out of the White House and out of certainly Speaker Pelosi, that if you don't believe what we believe, then just get out of the way. There are other solutions. There are things that we could do to our health care system that would fix what's wrong, keep what's right, make it so that the cost comes down, and make it so that people don't lose their health insurance if they change their job or they lose their jobs. Have appropriate liability coverage so that we end this ridiculous lawsuit mentality that we have as it relates to health care. So there are positive things we can do. As chair of the Republican Study Committee, we put a bill on the table, H.R. 3400, not 3200, but 3400, that we believe solves the fundamental challenges that we have.
Well, the dialogue continues. Congressman Dr. Tom Price joining us from Atlanta today. We thank you very much, sir.
Thank you.